Hi, on today's video we're going to talk about some of the global standards that every IT health professional should be familiar with. Have you ever been in a meeting where an integration analyst mentioned HL7? Or perhaps a clinical informaticist talked about mapping SNOMED CT codes? Or maybe someone from the lab mentioned LOINC? If you're nodding along but secretly wondering what these acronyms actually mean and why they matter, you're not alone. Health IT is full of standards that allow health information to be exchanged, understood, and used safely around the world. And knowing what some of the more common ones are and why they matter can help you feel more confident in your conversations and more effective in your health IT work. Before we get into details, I'm Trey. I've been working in health IT for a lot of years, and I'm hoping to share some of the things that I've learned along the way so that it can help others that are in earlier stages of their career. Now, let's take a look at some of the most commonly used standards in health IT. We'll kick it off with ICD, or the International Classification of Diseases. It is a global classification system that is maintained by the World Health Organization. It's used for coding diagnoses in clinical care, research, and health statistics, as well as for billing in many countries. When it comes to health IT, every diagnosis in modern EHRs maps to an ICD code. Now, this might happen at various times throughout EHR workflows, with some systems tagging it right at the beginning when they start with problem management, and others not adding it until afterwards when it goes through the coding process with HIM. But it will eventually get there for each encounter. ICD-11 is the newest version that's out, but adoption at the moment is still in progress. So we have a lot of countries that are still working off of ICD-10, and it supports the reporting, monitoring, and analysis of different health conditions, both within the organization as well as across different organizations and throughout different countries. Next up, we have SNOMED CT, or the Systemized Nomenclature of Medicine Clinical Terms. I know it's a mouthful, so of course it got shortened to an acronym. It is a standard clinical vocabulary that is maintained by SNOMED International, a nonprofit organization with many member countries. Content is broken down into three main components: concepts, descriptions, and relationships. And when they're used together, they combine to standardize clinical phrases. SNOMED CT codes are available for many different health terms, including diagnoses and procedures, symptoms, family history, allergies, observations, devices, and assessment tools. Some countries might also choose to expand the SNOMED CT code set to meet their jurisdictional needs. So you will end up with the base set and then perhaps a Canadian edition, a UK edition, or a US edition on top of that. Next up, we have LOINC, or Logical Observations, Identifiers, Names, and Codes. That's one that you'll probably never hear spoken in its extended term. It is maintained by an organization called the Regenstrief Institute, and it provides universal identifiers for lab tests, clinical measurements, and observations. When lab results go from a lab information system or an external lab into your EHR, or from your EHR out to another provider, LOINC codes will ensure that the receiving system can interpret, trend, and act on the lab values. It also supports the broader interoperability of health data to make sure that hemoglobin A1C is the same test when it's ordered in Cairo or Calgary. LOINC is freely available and widely used internationally. It's also been incorporated into some legislation for certain countries. You will also find, similar to ICD and SNOMED CT, countries that have a modified version of LOINC. In this case, they've translated the LOINC into things that make meaningful sense in their country, or they've limited the subset of codes so that it is only what is applicable within their health jurisdiction. The last one we're going to touch on is HL7, or Health Level 7. Now this is a big one because that's actually an organization, but you'll hear HL7 mentioned as if it's a specific code set. Instead, it's a family of standards that define how health information is going to interact between systems. Think of it like the post office. HL7 standards are going to define how messages are structured, addressed, and delivered between different applications. It includes things such as HL7 V2, V3, FHIR, or Fast Healthcare Interoperability Resources, and CDA, or Clinical Document Architecture. Every time patient data moves between applications within your organization, to external organization, to HIEs, or to patient portals, chances are pretty high HL7 formatting is responsible for that data exchange. So we've talked about a few different code sets here. And the key thing that I want you to take away is that these don't work in isolation. They're really meant to complement one another within the EHR and within the whole health IT ecosystem. LOINC standardizes lab tests, observations, and measurements. SNOMED CT provides clinical meaning. ICD offers disease classification, and HL7 standards carry the messages. So even if you're not a standards expert, knowing what these standards are and how they interact with each other and what role they play within the health IT ecosystem can be helpful for you when you're having those conversations with other teams. So when it really comes down to it, these global healthcare standards aren't just technical requirements. They are what's driving the sharing of information between Vancouver and London. They're also the reason why a lab test ordered in one country can be reviewed and interpreted by specialists in another part of the world. As health IT professionals, when we talk about some of these standards, it's not just about how they're mapped within your system. It really is about participating in a global communication network. If you found this helpful, don't forget to let me know in the comments or give me a quick thumbs up. And I'm going to try to put out videos at least twice a month going forward, so I will see you again next time.